Before 1987, this was a very sad situation, and emotional support and understanding was all that we had to offer. Before 1985, we didn't really know that this was animal, vegetable, or mineral. The introduction of the first drugs, zidovudine, was impactful because there was biologic activity, but you didn't have to be a virologist or a clinical trialist to recognize that this was very woefully inadequate therapy, and actually patients knew this as well. And so there was a period of time of about a decade of ineffective therapy, fraught with toxicity, that was used half-heartedly and not embraced. In the mid to late 90s, it was a profound breakthrough, and that was with the introduction of multiple classes of antiretroviral drugs, particularly the protease family of drugs. And this was tectonic and transformative, and it took people from the brink of death, and has added on many years of life. And since that time in the late 90s till now, we have progressed the introduction of many additional agents and several other additional classes that, when things work well and people have access to drugs and their virus is sensitive to drugs and they take their drugs, this is a manageable disease, but not one that is without adverse effects on their quality of life. But considering the alternatives, this is a dramatic turnaround.
So as Dr. Calabrese said in the past, we were taking multiple drugs multiple times a day with a lot of different things, thinking from a pharmacist standpoint in how they're supposed to be taking it with food at different times, different intervals. Patients used to have beepers to go off to remember to take their medications. Now, our most commonly used medication, at least in our clinic, is Atripla, which has 2 classes of medications, 3 total medications, all in one tablet, which is taken 1 pill once a day. Greatly improved adherence overall, and our patients, after getting through some of the side effects at the beginning, seem to do very well for a long time on this medication. As we have it out longer and longer, we're able to see side effects that may happen later in therapy, but we have shown that it is safe to continue to use for many years for our patients. There are some other medications in the pipeline that are looking to also formulate multiple classes of medications into 1 pill. In addition to Atripla, we also have Stribild, which is a different class of medications. It's 3 active medications with a boosting agent in it, as well as Complera, which is also 3 medications, 2 classes of medications in 1 tablet. So we're seeing a lot of advances just in the number of tablets, and hopefully increases in patient medication adherence as well by decreasing the number of tablets they need to take each day.